Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then Thionamides. Okay, thionamides. Thionamides. Mechanism of action of thionamides. These thionamides will actually inhibit the enzyme thyroid peroxidase. Thyroid peroxidase is responsible for formation of monoiodothyroxines and diiodothyroxines. Because it inhibits the enzyme thyroid peroxidase, it thus inhibits the iodotyrosyl coupling, and thus it inhibits the formation of monoiodothyronine and diiodothyronine, and thus it decreases the production of thyroid hormones, and thus it will inhibit the thyroid hormone production or synthesis. Then thionamides pharmacokinetics. Pharmacokinetics are it is actually well absorbed. These have high hepatic metabolism. High hepatic first pass metabolism is seen for these thionamides. The drugs in the thionamides are we have propyl thiouracil, then methimazole and carbimazole. So if you see the methimazole is actually the most potent drug, and it is the longest acting among the thionamides, whereas propyl thiouracil is the shortest acting drug, and it is also maximally protein bound. It is also maximally protein bound. It is the shortest acting and maximally protein bound, and this carbimazole will get converted to, it will form methimazole, which is the active metabolite of carbimazole.
thank you and thank you for watching.